Okay, well, welcome.
Hi. Thank you.
If you'd like to introduce yourself.
Yes. I'm Kristen Whittle. I work at a company called Bates Smart. We are a long-standing firm from Melbourne. In fact, we're 160 years old next year. So we tend to work on a lot of different projects, from arts buildings to hospitality to health, and broad range. So, yeah.
And tell us about this one then. Congratulations on winning the category.
Thank you. Yeah. This was an amazing opportunity for us. I think on a personal level, I'd never done any health projects in my life before. So I guess coming from a more creative standpoint and seeing, we had a fabulous kind of structure to the competition when this thing was created, where the government themselves had done a lot of research into health, and where they wanted to set a new world benchmark with the building. So we went through a very awkward PPP. I don't know how much you know about PPPs, but we went through a PPP.
Partnership.
Yeah, enormously complex and difficult processes, and we went through that, came out the winners, but we managed to enhance the brief and add new program to improve the model of care. So that was exciting to start with, and then we just had a lot of wranglings during the process that made it a very impure delivery model, but nevertheless one that was full of the right sort of energy and positive thinking, but interesting attributes from a design standpoint, as well as a more sort of scientific health kind of standpoint.
And how big is this hospital? Because maybe it's the same in Australia. In London, hospitals are getting bigger and bigger, and it's getting harder and harder to insert them architecturally in a kind of convincing way into an existing city fabric.
Well, this is a big hospital. It's it's over $1 billion, which is more pounds now than it was a year ago, because of the exchange rate. Australia's kind of become a really ridiculously expensive place. But anyway, the $1 billion project was able to deliver a sort of a very broad cross-section of program. But actually, the interesting thing is the amount of beds in this hospital is more or less the same as the existing facility. So even though it's a much bigger building, there was only the same amount of beds. And the reason for that is that it's become a more specialist acute care hospital. And the idea here is not to deal with vast quantities of kids, but more become a specialist model for only the acute problems relating to your heart or cancer, etc. So, it's got a very particular standing in Australia. But interestingly, the biggest public fundraising thing that goes on in Australia is for the Children's Hospital. Okay, so it's a much-loved institution within Victoria, but also nationally. So it was like, how can a sort of hospital be also an icon or a civic building? Ron?
Hi, come and join us.
So it was particularly like the level of difficulty in delivering such a building to us was it couldn't have been higher, and I don't think I'll ever be involved in a project that's really been this difficult. Ron, you need to introduce yourself.
Okay, I'm Ron Billard from Billard Leece Partnership. We did the Children's Hospital as a joint venture with Bates Smart, where Kristen is from. A project like this, we had about 100 staff working on it between us. It's a collaboration of a lot of people, so we all did complementary skills. I was particularly involved with the planning of the building, the planning of the site, and where all the elements were.
And you mentioned before that it was a PPP delivery method, but what are you most proud of in terms of the architecture? What innovations or what kind of architectural techniques were you able to use to make it a better functioning hospital, to make healthcare more effective?
Well, there's not one thing, but look, I look at a building from the inside out, and the most important thing to me was to make a building that made it relaxing, not stressful for the children, and with the children, the parents. So, because hospitals can be really scary places, and so there's lots of devices, the views out, the interaction with the park, but not just that. It's the how we introduced the aquarium into where the emergency department was, how we introduced the meerkats in the biggest area of clinics, where that's where the majority of people go. In fact, not in beds. 250,000 presentations a year to the clinics. Things like that, and we're getting lots of good feedback from parents who've been there. And some, you know, I've just got an email from someone who had their child in there for 3 months, and they were there for 3 months every night. And they thought it was just a wonderful place to help them through that stressful process. That to me is really, really important, and why it's good doing a children's hospital.
Can I just maybe outside of what it looks like and all of that, the physicality of the building, it's more the process that I found quite interesting. I mean, it was enormously difficult for us, but to form a kind of open-ended process with government, with financiers, with a multitude of different doctors and researchers and children who were part of the focus groups. We had thousands and thousands of meetings, and I think it just kind of shows if you can effectively collaborate with the community and politicians and have a kind of open process, but also a creative process that's both technical and imaginative, you can do anything, really. And we fought battles here that we'd never dream of winning, but we won. So,
well done on that. One final point. A lot of architects who work in healthcare in the UK say that the biggest problem is the consultants, because the consultants always have the power and they always want their offices to be next to their wards, so that the hospital ends up being designed around the specialists rather than the patients. Does that happen in your experience?
Well,
and how do you deal with it?
Yeah. Look, that was one of the transformational things we did in this hospital. The brief, we did some work originally on the brief before it came out as a bid, to try and pull the consultants, all the doctors, away from their particular ward, because they were building bespoke wards and their clinics are all in their wards. And we convinced them to move out and have that west wing, which is where all the consultants are, in open plan, which was a big move away back for them.
Oh, really? So they don't have their little private territories anymore?
They're not allowed to. What used to happen, I dare say happens in Britain too, the doctors would see their private patients in their rooms. Mm-hmm. That's not allowed. They have to see their private patients in the consulting rooms. And so that transformation, it's actually getting very good feedback. That what it's meant is the doctors' health now, sick kids have normally got more than just a cancer or more than a neurosciences problem. It's broader than that. And by interacting with other professionals, they're looking at solving those problems in a holistic way. And they're finding that very positive.
Well, amazing. I mean, I think if news of open plan consultants' offices gets back to the UK, there'll probably be a bit of a storm. But congratulations on winning the category.
Yep.
And good luck with the big prize later.
Okay, thank you
very much.